How would you feel if one of your loved ones was told that shock therapy or ECT will be helpful for them with their medical condition? I've had the privilege to witness 3 ECTs done on patients that were diagnosed with a psychotic disorder or a major depressive disorder. ECT stands for electroconvulsive therapy and is a controlled medical procedure in which a seizure is indicated to produce a therapeutic effect. Many psychiatric disorders have been treated using ECT since the 1930s. And in 1938, ECT was introduced by Italian neurologist Ugo Serletti. Back in the 30s, ECT was performed without anesthesia and therefore gained a lot of controversy because of its barbaric nature. But since the 1950s, it has been done under general anesthesia. The goal is to produce just a slight amount of anesthesia, because if the patient is over-sedated, it can cause cardiovascular and pulmonary problems and cause problems arousing the patient after the seizure. In conjunction with the anesthesia, neuromuscular blocking agents are also used, and these are used to prevent bone fractures and physical injury related to the excessive motor activity during the seizure. Before the electrical stimuli can actually be introduced to the patient's knee, ankle, and plantar reflexes are tested to see if they're diminished. And this is done to make sure that muscle relaxation is sufficient. After the desired level of unconsciousness and relaxation is achieved, electrodes are placed. And according to the 2010 edition of Psychiatric Mental Health Nursing, electrode positions include 3 different positions. The bifrontotemporal, the right unilateral, and the bifrontal positions. And I have a visual aid that I have created in order to show you some of these different positions. Right here, this is the side view of the bifrontotemporal, which basically is they place the electrodes on both sides of your temple. That's the one that's most commonly used. The right unilateral one is the one that doctors like to use because it reduces the side effects of cognitive disturbances after the procedure. And they place an electrode on the right non-dominant hemisphere because most people are right-handed, and one on the top of the head in the vertex. The bifrontal is used sometimes, but the only difference between the bifrontal and the bifrontotemporal is that it's placed 6 centimeters more anterior to the front of the head. This is how they used to perform the ECT. Since they didn't use general anesthesia, the nurses had to subdue and restrain the patient, and it was, severe. And here you see that the nurse is at the bedside, but the only thing she's doing is monitoring vital signs and making sure that the patient returns back to pre-procedure status. So after the electrodes are placed, the most important thing is that the patient has signed an informed consent, understanding the treatment and the side effects and the whole procedure and what's going to happen to them. If they can't do this on their own and they're not in their right mind, they can get the next of kin, somebody that has their best interest in mind, to sign that for them. According to the 2010 British Journal of Nursing, the aim is to produce a general seizure, and the treatment is not related to the duration of the cerebral seizure. Prolonged seizure activity of 2 minutes or longer is contraindicated because this can cause severe long-term reactions. The patients will usually have 2 treatments a week for 6 weeks, depending on the severity of their diagnosis. ECT is proven effective and has a faster onset in the action of any type of pharmacotherapy. Common side effects include headache, nausea, vomiting, and muscle pain, and most of the times these can be resolved with analgesics. Another side effect is impaired memory and confusion, and according to the 2007 Harvard Mental Health Letter, that is the most common complaint of most patients, and it's memory loss. Tests have shown that retrograde memory, which is memory from before the procedure, and anterograde, the ability to absorb new knowledge, diminishes after the treatment has progressed over more than 3 years. Most doctors agree that patients will have permanent loss of memory and may experience forgetfulness throughout the day. Random controlled trials do demonstrate the superiority of ECT compared with tricyclic antidepressants or any other antipsychotic medications. So in conclusion, to sum it all up, ECT has been controversial because of the fear of misuse and because of its barbaric nature. It's been proven effective for the acute treatment with psychotic symptoms, and is preferred over pharmacotherapy, or a lot of times used in conjunction with that. Also, ECT has an important role in contemporary mental health care, and the process is supported by evidence-based efficacy and safety. But the most important thing is that the patient receiving the treatment knows the procedure, makes an informed consent, and understands the side effects of whether or not they want to accept the treatment or not.